for joining. Thank you everyone for joining us today and taking time out of your busy schedule. We really appreciate it. My name is Jessica Liu, and I am with our Center for Transformation. And I have the great pleasure of introducing our presentation today, From Ideation to Action, Transforming the Healthcare Consumer Experience. And we've got two great presenters with us here today who will talk a little bit more broadly about the consumer experience and what they, with their organizations have been through and experiencing as they try to create a really fantastic consumer experience. So we have Laura Pickett, who's the Vice President and Chief Family and Patient Engagement Officer from IU Health, that's Indiana University Health. And we're joined by Ryan McPherson, who is the VP of Commercial Strategy at Cedar. With that, I will pass it over to Laura and Ryan to do some quick introductions before we jump into our discussion.
Yeah, thanks, Jessica, and welcome to everyone who joined us today. It's really a pleasure to be here among peers and advocates who are passionate about this work. So thank you for having me. And I also want to thank the Academy and Cedar for all of the great preparation that went in today. It was a lot of fun working towards today. So for me, prior to nestling in to my current role, I was in various leadership roles across Indiana University Health, spanning from marketing, philanthropy, nursing, and strategy. And before I got my opportunity at IU Health, I was working in primary care and also professional baseball. So I carry some of those lessons with me. My statewide Office of Patient and Family Engagement primarily has two tasks. One is optimizing traditional patient experience practices, which is one of 4 health system goals here at IU Health. And the other is transforming what we call the patient and consumer journey. And this is the long-term path and how we'll transform how patients and families experience us today and even a couple of decades from now. Perhaps most importantly, I'm sitting 1 mile away from the house that Caitlin Clark built with the Indiana fever. So for anyone who is following her revolution, we're situated here in Indy. And Ryan and I are going to do our best to warm you up for the presidential debate this evening. But there will be one difference. Ryan and I don't want to get elected. We just want to make the journey a little bit better for patients and consumers. So we're looking forward to it. And Ryan, I'll pass the mic over to you for your intro.
Yeah, thanks, Laura. I really appreciate the opportunity to share the stage with you, so to speak, in this moment. And certainly we'll do the best I can to keep us moving and let everyone hear from you, really the star of the show here. So my name is Ryan McPherson. I'm the Vice President of Commercial Strategy at Cedar. After spending upwards of 20 years in the consulting business, working exclusively with revenue cycle and operations in healthcare, I made the transition into a career in healthcare technology a few years ago, and I've been Vice President of Cedar now, going on my 2nd year here, and grateful for the opportunity to speak with all of you on this really, really important topic. Before I hand it back over to Laura, who really is the star of the show here, I wanted to just share a little bit about who we are at Cedar, and why we might be sharing the stage, so to speak, to continue to extend the debate metaphor just a little bit more with Laura. At Cedar, our mission is to ultimately empower all of us to easily and affordably pursue the care that we need. And it doesn't take a whole lot of due diligence or research to really understand why this is perhaps now more critical than ever. At Cedar, we spend our entirety of our resources exclusively focusing on the patient's financial experience. We believe that we deliver a best-in-class service of that, but this is more critical than it's ever been for health systems. We pride ourselves at Cedar on really providing a comprehensive platform for both patients and providers addressing their needs related to the patient's financial experience. And along the way, what this looks like is we help patients understand and access, everything from affordability options to help cover their care. So allowing patients to self-direct into programs like Medicaid, pharmacy assistance, financial aid programs, whatever the case may be, to also providing them with the right, customized payment plan or discount based on who they are as a patient and where they are in their financial journey. And at this point at Cedar, we're very proud to have been to be helping over 50 providers and health systems around the country, processing over $2.6 billion in patient payments, touching 30 million lives on an annual basis, all of which ultimately translates to very material impact for the patients and our providers as well, to the tune of what you see here, driving material financial performance improvement and ultimately delivering, to no one's surprise, a more effective, more satisfied patient and ultimately consumer. And so with that being said, I'm really happy to hand it over to Laura to speak much more extensively about the experience at IU Health and what the novel approach that they've taken and that she's taken and led to really not just thinking about the financial dimension of the consumer experience, but a much more comprehensive view of the progress that they've made. So with that in mind, Laura, I'll hand it over to you.
Thanks, Ryan. So for those who are still warming up in their work week, it's Tuesday afternoon, depending on what time zone you're in. We're going to get a little participation from you all early, so we can seek to hit on what might matter most to you in our time together. So I just want to get a pulse on where you are in your consumer journey. We've got some overachievers who have already started answering amidst that, so I appreciate the vigor. Looks like we're starting to strategize. We have a strategy and we've got some endorsement. It's being operationalized. We even have some who are in the most advanced maturity model here, that a strategy is operationalized and it's being measured. And 0% are not strategizing. So you've joined the right call. All right. Well, thanks for your participation there. We can go ahead and conclude that poll and move on to the next slide there. Hopefully folks can see the results. And Kala, I'll depend on you to kind of X out on that poll. I think we've done that. So let's get into it. As I mentioned, we've got two focal points in my office, one of which is the traditional focus on patient experience, the care portion of the journey, and optimizing that. Specifically here at IU Health, we are focused on our two toughest spaces, which are probably similar to all of you, and that is emergency departments and our inpatient spaces. And then the second thing is really the long-term transformational journey. And you might hear me call our patient and consumer journey the PCJ in today's presentation, mostly because in healthcare, we're really uncomfortable if we don't have an acronym for everything. So a little bit more about Indiana University Health. Here situated across almost the entire footprint of the state of Indiana. So we're the only academic medical center in Indiana. And we work in partnership with our School of Medicine at Indiana University, but specifically what that means is we're training providers today and tomorrow's providers through breakthrough research to do that in a high quality and patient-centered manner. And the way that we do that is through our values here at IU Health. And so values can be something that are situated on a wall, but here you feel them at IU Health. And so we're guided by our values of purpose, excellence, compassion, and team. And we've got a really lofty vision here, and that is to transform Indiana into one of the healthiest states in the nation. If you've seen any rankings recently, Indiana is not near the top. And so we've got our work cut out for us, but I kind of like that. We serve about 1.5 million patients a year across Indiana and other states. And that care is represented through hundreds of care sites, hospitals, primary and specialty care, urgent care, virtual care spaces. We also have a health plan. And we also believe that not only the delivery of healthcare is important, but for that vision of making Indiana healthier, we have to actually engage with and support the communities that we serve. And so we stand behind investing in those communities in really significant ways outside of our walls. And then last but not least, what would be important for you all to know about us in developing this strategy is that the experience we deliver through patients is still delivered in a human kind of way. So there's 40,000 people, almost 40,000 people who are employed by Indiana University Health who are striving towards this vision of making Indiana a healthier state. We can go on to the next slide. This slide may look familiar to you, but one of the things as we began to catalyze this strategy is to make sure that we acknowledged where we have been, where we kind of are, and where we want to head. The nature of academic medicine is that part of our workforce trained with the IU School of Medicine and then was employed at IU Health and has stayed ever since. And then part of our workforce is brand new to us. And so acknowledging where we've been to figure out where we need to head has been paramount in us getting there or beginning to make progress. So kind of that 5-year span in 2012 to 2017, the word satisfaction became prominent. And we realized that HCAHPS and how we performed was going to be a data source for us. And it was going to parlay actually into payment and values-based incentives for hospitals to make sure that quality was being provided. And so we were very focused on a maturation curve of satisfaction. That then moved into the notion that we might want to extend beyond satisfaction into experience. And we moved into the progress area where many shops, including ours, launched what we called real-time feedback. And so how do we get a little bit more insight from those who are consuming our product to make sure that we're delivering something that would make folks want to come back? And then the pandemic hit, and lots of things changed, and lots of things didn't. But we entered this experience era of evolution, realizing that what we've done for a really long time isn't likely to work well in the near-term future or the long-term future. And so we had better develop a strategy that is more patient and consumer focused, that is in line with what consumers are experiencing even outside of healthcare. And so we've tested a lot of things in this era, and we realized that even deeper than experience is where we want to head with our transformation era and an engagement era. And so this is more journey focused, not just the care segment of the journey. This is reducing noise and focusing on behaviors that really matter to patients and consumers, and understanding that our workforce understands what that means and the essential role that they play within it. Could go on to the next slide, Ryan. This was another slide as we looked to cast our vision that really seemed to resonate with folks. And that was, we land in a place of frustration when we try to transform if we only inject cultural innovations, the artifacts, the behaviors, and the perceptions. If there's no structure to that, there's going to be frustration across the organization, ranging from the frontline team member who is serving a patient right now while I'm giving this presentation, all the way up to our executive team and our board of directors. Similarly, we're going to land in this place of inertia if all we build is structure and there is no culture affixed to it. And so we could put great leadership in place, great management systems and organizational structure, but if it's not anchored by culture, we're going to land in a place of inertia. And frustration and inertia can be two things that really prevent a strategy like this that's so transformational of catching momentum and moving ahead. And so one of the things we're really focused on here is marrying both of them, both the structural enablers that it will take for accountability, but also how that is underpinned by culture and how we're treating our current workforce and those that we're going to employ in the future. And we believe that those two things together give us the best possibility for enduring change, for lasting change. And for my office and me, hopefully something that lasts long after we're retired. You can go on to the next slide, Ryan. We also realized in the age that we're in that there's a lot of talk about tech. And it's absolutely a part of consumerism, and it must be core to our strategy, but they have to work together, right? So the way that we talk about human connection and tech in a hybrid engagement model here at Indiana University Health is that we need to deploy tech in a way that allows our humans to be practicing atop of license. And so we need to enable our humans to do things that have this really deep interaction and relationship with a patient or a consumer where they want it. And in the places where patients and consumers don't want that, we've got them supported through the tech. And we also acknowledge that in some places, patients or families might want both. And so we've really thought about this from a hybrid perspective. We can go on to the next. One strategy that we found effective when you're doing things at upper level of management is to make sure that you've got something that from a translational science perspective actually resonates with those who are closest to patients and consumers. And so with that in mind, we've really started with our why. And you see along the left side of the screen there, the IU Health Way. And that to us is our combination of our vision, our values, and our promise for patients. And so making sure that we're anchored in that, we're really seeking to have a transformation here. We aren't always easy to access or to get across, to navigate. Customization is spotty at times, and what that delivery looks like can be inconsistent. We're really interested in delivering on what matters most to consumers and actually knowing what that is so we can deliver on it. And all of that with the hope that it gives us an opportunity to create a long-term relationship with the patients and families that we serve. We had a hypothesis when we created this vision statement that our patients and consumers wanted many of the same things that any normal human being would want as they traverse life. And so what we did is we aggregated all of our research back to 2017, all the patient research, consumer research we had done, also any of the patient and family insights that we had gained, either from listening sessions, real-time feedback, or HCAPs. And we aggregated it into 4 guiding principles. And what patients told us they wanted from us was to be connected, to be known, to be cared for, and to be guided and supported. And so in all of the places that we're talking about this strategy and testing out new things, that's how we return to center. I go on to the next.
Or one quick thing before you move on. Sorry, just as the
Sure.
the tech guy joining the meeting, if you will. The one thing I was just struck by, and obviously, like you and I have been working together in advance of this webinar, but had not really worked together outside of that. But the one thing that I found really interesting as someone who works on the technology side of the spectrum, if you will, if you think back to your prior slide, is how much these guiding principles actually translate to our aspirational goals at Cedar, right? And frankly, how we've gone about developing our products at the end of the day. From a connected standpoint, we have a heavy emphasis on network connectivity. I spoke earlier about, allowing patients to reach Medicaid when it's appropriate for them or whatever the case may be, and the importance of that. We have, as someone who, as a company is proud to be investing extensively in our data science teams, a lot of that is in service of, really the two in the middle, both to some extent, which is knowing that someone is an individual and what the right answer or workflow may look like for them, and leading with empathy and a lot of the communication and actual product design principles that we employ at Cedar. And ultimately that comes through in a very personalized way. I think that aligns with this sort of guide and support me concept. So I was just struck by this when I was just sitting here listening to it and hearing you speak to this. And I think it's actually something that may help tie together the two sides of the hybrid model you discussed, which is great.
Yeah, I've learned the same thing as I've learned more about Cedar too, Ryan. So I'm glad you brought that up. And I think, another way that Cedar's kind of leading the way here is figuring out what metrics and how do we measure, right? And so as we've thought about our vision and our guiding principles, we're still in formation stages of how we measure our progress. And, I'll share with this group that some are more known to us than others. But we believe that it's going to be a handful of things that we want to measure that are going to be important to us as we move ahead with this strategy. And what we've considered to date are looking at patient lifetime value, net promoter score, share of care, and health outcomes. And so, a complementary to that is much of the industry leading work Cedar has done with financial metrics and how we think about that work to make sure that when we cast something forward, we've actually got a litmus test on how do we know if it's working. So that's one part of our strategy that's still going to require some more development. But at least from a macro perspective, we certainly have been thinking about how do we know if what we're doing is working.
sorry, that took us off topic a little bit, but thanks for that. I'll jump on to the next slide.
Yeah, you bet. So here in the red, these are likely familiar to this group. But these are, kind of the consumeristic themes and how we believe that will get there. There we go. And so if we weren't in a healthcare webinar and we were in a different industry, many of these words in the red boxes would be similar to what all companies are attempting to deliver to customers. But since we are in healthcare, it's even more personal. And so, we see a direct connection between the guiding principles of patients wanting to be connected, known, cared for, and guided and supported, to patients and families saying, and you can do that through convenience, through personalization, through consistency, outcomes, coordination, and insights. And if I were a consumer actually presenting this slide and not leading this work, what it might sound like is get me in when I need to get in, treat me like a human, not a number, make sure I know what to expect whenever I see or engage with your brand, get to the heart of my matter, talk to each other and be aligned when you interface with me. And when I tell you something, treat it like it's a gift. That's what a consumer might say about how these principles actually transform into what we deliver for them. And I want to call out one in particular. And this is the personalization box you see there. And I just want to make note that healthcare has grown so substantially in recent decades that the name of the game for a while to be able to scope was equality. Make sure you give everyone the same thing. But that's not only unresponsible in today's climate, it's pretty tone deaf. And so this personalization theme for us is one of the ways in which we can be much more deliberate in strategy and deployment for our historically marginalized and or underserved populations, and making sure that that's a core piece of what we do in every moment we get an opportunity to lead.
Hey, Laura, I just want to call your attention. I know you're presenting. There was a question in the chat. Viviana had asked on the prior slide, I think, if you could just maybe expand a little bit more about the patient lifetime value concept as a North Star, as a metric, if you will.
Yeah, Vivian. So I'd be happy to talk with you a little bit more offline with that too, because that's one that we're still definitely in code development. But I think sometimes this can be looked purely as a financial metric, right? And so you can pull how is it that if we retained loyalty over time, what would that look like to a health system? But I think this is one of the places where we could actually look at how that is complemented by the health outcome that may be achieved from the consumer receiving the healthcare in this case. So we're still developing that one, but really that's our metric to get us to look not only today and tomorrow, but across the lifetime of the engagement with Indiana University Health. What does that value look like to the organization, to us at IU Health, and what does value look or feel like to the consumer who's consuming it? Thanks, Ryan, for the call out on that. I've not been doing a good job of keeping an eye on the chat, so thanks for having my back.
That's your hands full. Good.
I think I'm passing off to you now, Ryan.
Yeah, I think one of the things that we were going to discuss next was another poll. Laura tees up the next portion of her conversation here, is a little bit, just wanted a pulse check from you all. And Kala, I think if you don't mind, let's make sure that we end the poll so that folks have a moment or two just to reflect on the outcomes and results of this.
Yeah, so we've got responses coming in here, and this one is a bit more lopsided than our first. Folks on the webinar are citing organizational culture is not ready for the transformation as a lead horse, and then resources to support the strategy are lacking as another lead horse. We still have some comments leading in, but for those who appreciate some play-by-play, hopefully I've put my best foot forward there. I believe we just shared results there. Hopefully our attendees can see where we've landed. Really, kind of our top one there is organization and culture isn't quite ready. And then the resources right behind it. Okay, good to know. So from here in our strategy, we really tried to break out what is the current state within quadrants of our strategy, what would the future state look like, and what do we think might get in our way or could be an enabler if we did it better. So when we think about patient and consumer centricity, there's been some spotty elective adoption of what the patient and consumer mindset is, and I would attribute this back to the maturity model that I shared earlier, where much of our work began simply talking about a satisfaction metric within a mailed survey that had lagging data. And so what it looks like in the future is people understand it and we're relentless in our pursuit. Frictionless is often a word that we use in this space. But gosh, we've all had our own healthcare experiences. The future is make it easier, right? And if you can, make it meaningful. And what we'll need to do in order to get to that future state is metrics adoption, which I've noted earlier. This workforce who, when there are human interactions, that it's a service orientation, like what consumers might experience in other industries who have hospitality as a core principle of what they deliver. It's maturing in how we gain the voice of our customers and not just a post-discharge survey or other items that are more reactive than proactive. And it's figuring out how we leverage automated learning tools so that we can act more quickly. Ryan, did you have any insights on that one when you think about metric adoption and some of that whole journey measurement?
Yeah, I think, appreciate you asking. I think from my vantage point, again, from a technology provider standpoint, I think at the end of the day, it's just critical that we align ultimately at the end of the day with meaningful outcomes in service of the patient journey we're talking about. And I think that's to your point of the whole journey measurement. Ideally, outcomes from the point at which a patient first experiences you as a provider of care, ultimately to the last moment that they experience you within at least an episodic continuum, if you will, acknowledging all the things that you said also, Laura, about the importance of, the patient's aggregate value over the course of their lifetime. So what we've observed often is, oftentimes technology providers may index a little bit more heavily on a leading indicator, but not ultimately be as able to discreetly connect with, a singular or a small subset of meaningful outcomes that are in service of your consumer journey. And so, that's where we've been spending a lot of our time as a company these days, is how can we connect more meaningfully to outcomes and demonstrate, for the space that we operate in around the patient's financial experience, what we assert are an underserved dimension of the market, which is elevating the importance and the criticality of the patient's financial journey.
Yeah, thanks for that, Ryan. And I think, kind of carrying forward with some of that, with another quadrant of our roadmap, convenience, access, and insights. So really, we've been an industry who's been locally oriented. You come to us in this place, and we'll provide you something. But really what consumerism calls us to do in future state is to figure out how is it that we might leverage a technology to be predictive about the holistic care that we can provide. So I'll give you a use case example in this one. In a past state, we might call it good if when someone is discharged, whether inpatient or outpatient, we have their next appointment scheduled. But the piece we might have missed is what we scheduled work for the patient to come back? And do they want to come back to bricks and mortar, or would they like to do something virtual? And so having a holistic predictive view of what patients and consumers have selected in prior engagements with us, and then auto-populating and asking if that works, would be more of a next-gen model of how we can actually get more patients in and provide better care in a way that may have been different than in the past. And then last but not least, we've got highlighted here kind of the technology, data, and analytics section. And so in healthcare, we have all kinds of data, but in our ecosystem here, it doesn't always talk, overlay, or translate into something that's easily actionable for someone who is one step away or directly working with patient or a family member. And so figuring out how can things be a lot more automated to drive action in an easy way for those who can drive action. And this can happen both in the tech space and in the team member space. And when both of those wheels are turning well, then working together, really, there's more value realized for the patient in those situations. I think we can move on to the next, Ryan. So then we get into the operational component, and we can move right on to the next slide here. What we've done is we had a reflection session with multiple teams who will help to lead this work across the organization. And we gave folks an opportunity to say, what's been getting in our way, right? And actually get that down on paper so that we could move past it. And one of the things we learned about ourselves is that, sometimes academic medicine, for good reason, can move fairly slowly. And consumerism requires us to move swiftly, to test, to learn, and to evolve. Then we focused on, what are our opportunities and our focus areas. And we realized that, the opportunity to figure out what governance looks like for this so that it is centralized in a way that still makes sense for our regional model here at IU Health. And then to make sure that folks know what we mean when we say patient, but consumer is a newer word to most of our workforce. And so making sure that everyone's starting with a baseline of understanding. And so after we did those two things, we said, well, what are we going to do next? And so we moved towards clarifying our division, prioritizing our near-term focus, and then thinking about the cultural components and training that we would need to help support folks in getting there. And so that resulted kind of in our next slide here, which is our high-level roadmap. And we had a hypothesis about the amount of ground that we would need to cover. We knew that this roadmap would be multi-year. We knew there'd be some places in this roadmap where we were able to accelerate rather quickly, or think of it as, low-hanging fruit that we could get after right away. And there'd be other places we wanted to move quickly, but we actually needed to decelerate to be able to accelerate. And so what you're seeing here is the black boxes represent the 4 quadrants of our strategy. You'll see they're anchored in the middle there in the red box. And this is a place that we spent a lot of time and goes back to our hybrid engagement model about human connection and the tech space. And that is that we got to start with our people. Then there's got to be a process, and then technology complements that. At times, we will deploy a technology and our team members may or may not know about it, right? I'm sure I'm probably the only healthcare professional in the room that's happened to, but we really have to think about what does that integration look like to actually maximize the time of a human where the technology can provide more value and do it more efficiently. So it's a yes and instead of an or. The bullets beside the black-red boxes are one click down of where we thought we should probably get started. And I bet over the next couple of years, this will morph and change a little bit. But we wanted to have some starting blocks so that when the race started, we said, here's where we're going to go, board. And the board could get behind it so it was a bit more palpable. And so we had that hypothesis and developed this. And then the next phase that we moved into to operationalize it was we knew that we needed a refreshed baseline on much of our patient and consumer research. And we can go on to the next slide here, Ryan. And so what patients told us is that we needed to expand where our work was focused at first. Now, good looks like consumerism across this entire journey. But we had been mostly focused in the delivery portion. And what our consumers told us in our most recent research is that the most value you could provide to me is to expand beyond that delivery portion of the journey and make sure you're getting into the access and the immediate portion of the ongoing care. Our consumers also identified for us within that red dotted box, what are the moments that matter most? Translated internally to, if we're going to focus our teams and resources in a handful of places within that dotted line red box, where would they be? And what they told us is, those pre-care delays, make them less painful. That patient treatment, yes, absolutely. Get the diagnosis right. And remember, I'm also a human, not a diagnosis. Connected care. Can you all please make sure that you're talking and that the message you give back to me is informed and consistent? And that post-care coordination. When I leave as a consumer, I might stop thinking about you, but you shouldn't stop thinking about me. And so this has really guided where we've started with our strategy, and maybe more importantly, the how. We can go to the next slide, Ryan. This is a pretty busy slide, so bear with me. But you see here, it's a similar slide to what we just saw, but we've layered in our guiding principles. And so the connect me, guide and support me, care for me, known me, this is our historical voice dating back to kind of 2016, 2017. We know those guiding principles are maintained and important still today. And then at the very bottom of the slide, within our expanded strategy, those are the moments that matter. There's a small light red dotted rectangle right below delivery. And that depicts where we had been focused. And based on research, the expanded focus where this strategy will deliver the most value is in the heavy red dotted rectangle. And so this visual has been really important, especially for the workforce that has been with us for quite some time, about where we've been and where we need to maintain focus and expand it. We can go on to the next, Ryan. So the way that we've brought this to life, you see the 4 moments that matter here: the pre-care delay, patient treatment, connected care, and post-care coordination. And what we shared with our teams is the actual clip of the patients. And they told us, when you really deliver on a moment that matters, here's what it feels like, right? So we're getting into this emotive space. And so we don't have time to share all of them today. And for confidentiality purposes, we've actually de-identified, and we're not showing you the videos, but we can actually let you listen to one clip of connected care moment that matters in the delivery space.
The nurse practitioner came in, we had seen each other before, and so she's very friendly. She remembered me, which was nice. One of the doctors one time said, "Nice to meet you." And she delivered one of my other babies. I was like, okay. But I don't even think she works there anymore. So this lady at least looked in my chart that we'd met before or remembered me, one of the two.
So I want to double back. That was actually a pain point. My apologies. And so in that connected care delivery, a provider had seen that patient before, but didn't remember that she had delivered one of her kiddos. And that was quite a pain point for that patient. If we go on to Bright Spot, in the same space, here's what it sounds like when we do it really, really well.
I think you get better outcomes when you're involved than you do if you're just there being treated. I think you get things that really work for you instead of just what works for most people. I think overall better outcomes, and you're not just a passenger. You're not just like the passenger, you're like, helping navigate.
The consumer tells us they're not just a passenger in their care, they actually get to help navigate. I'm sure that resonates with a lot of folks on the call. And then last but not least, our strategy on the next slide here was supported by our board in December of 2023. Here we are on the 10th of September, 2024. So we're about 9 months in. And what you see in the red is the same strategy slide you saw earlier and some of the progress that we've made. Some more aggressive than others. I wish the entire map had red, but we've picked off what we can and we've partnered where we can just to get started. And there's a lot of places that you can start. But we made some progress, still have a lot of work to do, but it's a worthy journey. Ryan, I think I'm going to pass off to you now.
Yeah, thanks, Laura. And as I start to step in here, I think the comment you last shared is, lots of different places to start. And as I look back, and I was just taking some notes throughout the meeting, but going back to the first survey, which was, where are you on your journey? I think roughly half of the folks that were in the discussion responded with basically starting to figure this out. And from Cedar's perspective, what we would assert is, while I use Loctite, broad, comprehensive, and sort of institutionally aligned view is a fantastic place. That's frankly, Lori, I think the start of your timeline was like 2012, right? Like in some capacity, this is a capstone of what's been a decade plus journey. Many organizations are not that far, certainly don't have the cognizant awareness of this being something that's been that conscientiously developed. And so what we would assert, from Cedar is that the payment experience and the financial experience is frankly a no regret bet place to start if you are starting to sort of figure this out. Everybody who is a patient at your organization is going to be experiencing some dimension of financial care and financial experiences, sort of, again, from an episodic basis, the first moment to the last, including after the care intervention or the care process itself. And so we at Cedar continue to study this and the relative importance of this. And really what we've observed is that fully 40% of patients are demonstrating markedly different behaviors because of the difficulties that they experience in the financial journey. And beyond this, and one of the points that we don't necessarily have up here, Cedar sanctions a study every couple of years that we co-author and co-sponsor with the Economist Group. 50% of patients would actually respond that financial stress has negatively affected their ability to care, to heal, or to receive healthcare. And our perspective is you can get a lot of benefit out of just starting in this space. And yes, the financial experience can be one that's fraught with a little bit of a blame game, where patients are coming to you with problems that maybe you don't have direct control over as a provider of care. You all are frustrated with the insurance plans, perhaps, and everyone's angry at the pharmaceutical companies. But what you can control as a provider at the end of the day is the experience from a financial perspective that patients do have with you as a provider. And so, Cedar is very excited to have been, working with many organizations like the IU Health of the world as a first stepping stone on their consumer journey. But if you are just starting your consumer journey and you're starting the financial experience effort and service of this, it's oftentimes difficult to know where to start. And Laura did a good job of outlining the importance, I should say, of measuring what you're out to affect and what moments matter the most. And so in service of that, one of the things that we observed at Cedar is that there's not a whole lot of people who are actually measuring this financial experience. And so one of the things that we've done to address this is launched a patient financial experience benchmarking study aimed at helping organizations who are interested in learning more or making the financial experience more an intentional part of their consumer journey, helping them figure out what the plan could look like for them. And we did this because as we studied this opportunity across the market, you hear a lot of organizations discussing how they're doing in this space, but they're using not necessarily important outcomes, but they're thinking about things like feature adoption, or they're distracted by the balance of their business, which is, not necessarily patient balances and patient AR. And so the finance teams tend to focus away from the importance of the patient journey. And so we at Cedar feel called in service of our mission to help organizations address this, and have launched this financial experience benchmarking study in support of that. And so I won't necessarily belabor the entire point, but this is certainly something that we feel very passionately about. And if anything that I'm speaking about here is something that resonates, I would love the opportunity to just learn more and share a little bit of our perspective with you all as well. just to wrap us up, because I know we want to make sure we at least preserve a little bit of space for anybody who may have some questions, and preserve a little space for Laura or I to answer some questions. We'd also love to continue the conversation outside of this, acknowledging that not everybody is comfortable or can chime in right now. So mine and Laura's contact information is both listed here. If you'd love to continue this conversation, I know I speak on Laura's behalf in expressing a real strong desire to do precisely that. So with that, I will, Jessica, I think, open it back up to you and allow any Q&A to occur.
Thank you very much, Laura and Ryan. I wanted to open up the conversation to any questions that you all may have. I think you've heard Laura and the IU Health journey from really this like gleam of an idea to actual execution. Kind of the areas that have gone really well and the areas that they still struggle with. And really one is just where to start as part of our consumer collaborative. That's something that we hear all the time, is where exactly should we start? And I think Ryan gave a really compelling rationale for a place to start, really around the patient financial experience. So just would like to open it up for any questions that folks may have. And maybe while people are thinking about questions, I know that I had one that just came up from hearing from all the conversations we've had, and also just Laura, hearing you walk through your strategy. I know that you all are just getting started, but there's always, I think, a question on folks' mind in terms of where do you take this as you think about checking off the boxes that you already know that you need to check off. Where do you see this going kind of more long term, if you think about maybe even the next, like, I don't know, 5 to 7 years? How do you think your strategy will continue to evolve, or how would you like it to continue to evolve?
I think it's a good question, and probably folks have various answers, but I just think we're headed into consumers who are more and more comfortable with digital interface. And much of the population kind of realized during the pandemic that a lot could happen from home or from any location that they are to get a service that they needed. And so I would anticipate that the healthcare systems who are most apt to deliver value in the digital space when the consumer wants it, or to allow the consumer to test if they want it, are likely those who are able to kind of do a lot of that top of funnel work to provide services, and then prove that patients would want to stay with them by providing value. So I really think that digital space is going to continue to grow pretty substantially, and that care will be delivered in non-traditional ways in the future.
One thing I might just offer, almost an extension of that too, Laura, is within the financial space. I think that, we're seeing the more piece with just a real great emphasis on self-service and an emphasis on confidentiality and privacy, right? So, the current tendency or proclivity of organizations to force patients to have really sensitive conversations around finance and economics and, different pieces like that. Those, healthcare stands alone as an industry in which a lot of those conversations are occurring face-to-face these days, or at least the majority of those conversations may still be occurring face-to-face, either over a Zoom or wherever the case may be. And so patients engaging on something that's as sensitive a topic as that, the expectations bar has been raised toward, you should know enough that you are handling my situation differently than anybody else's and meeting me in the time and medium and mode that I want to be met in.
So we've got a question from the chat from Vivian, and for any folks, if you would like to come off mute, please feel free to do so. So Vivian Stewart, something that really resonated with me is the importance of coupling structural enablers with cultural interventions. When thinking about cultural innovations, how did you address the behavior and perception components?
Well, I wish we could say that we had mastered it and that I had written my doctoral thesis on it. I'm still working on that. But here's what I've learned that I would offer to the group. Culture is a really deeply rooted thing. right? And so when I talk to team members or my office talks to team members across the state, we recognize that there are 5 different generations of employees in the workforce right now, serving 6 different generations of patients. And all of us have very different needs. And so we've thought about where would we start? And the place we've decided that we need to start is with our current workforce. But there's a huge component to this of how we recruit, how we think about retention, and how we place the right people in the right roles to deliver some of our cultural innovation or cultural intervention. And so we believe that there's kind of 3 components to it. One is, how do we expect folks to communicate to patients and consumers in any space? Traditionally, we talk about how that happens in person, but that's not what our business is overall anymore. We talk about what is the service, the minimum standard of the service that we expect all patients and families can get across the journey from us. And then the flip side of that is team members have to know that they are safe. So we are asking our team members to deliver the right communication and the right service alongside the assumed clinical diagnosis that is accurate. But then in turn, we have to also make sure that they feel safe to do that. So that's kind of how we've approached it. And I think we did listening sessions across the state where we asked team members to say, what would get in your way of communicating consistently and in a coordinated way? What would get in your way of delivering much of the service components? And team members were really willing to tell us, right? And safety came through really high. So that's one that popped up for us that we make sure to talk about when we're talking about the cultural interventions. And it's really in close partnership with each of our regions across the state and our HR function to make sure that we're training in a way that's emotive and that will stick with team members after they get through orientation.
Thank you very much for that, Laura.
Mhm.
And I think it's just interesting as you talk about just how many generations are involved in both the care process and who you're caring for. And so it just becomes a much more complex mathematical problem than just 2 and 2. So I think we probably have time for a couple more questions if folks have any. I will take silence as a no. Maybe I'll close us out with one, just last one from, because as somebody who works very closely with our consumer collaborative, we spend a lot of time talking about benchmarks and not only how do we get to the benchmarks, who we benchmark against, but really how do you apply them? I know, Ryan, as you all are working on your scorecard and you're working with some of your health system partners, can you kind of share any of the early learnings that you all have and that you've acquired on how some of your health system partners might be able to apply the learnings from these benchmarks and kind of where you see that coming to life?
I'd say, and maybe this goes to a little bit of some of the blockers that Laura we had asked about, but I think data goes a long way in terms of helping people understand this or generate a bit of a sense of urgency around any given topic. I mean, certainly from Cedar's vantage point, this is around the patient's financial experience. I suspect that Laura, if you were going to go talk about the value of some of the information you glean from other industries and things like that, there's probably a similar story to be said, which is, from a change management perspective and a need to generate a sense of urgency around a given topic, the ability to shift the conversation a bit away from speculation or intuition to objective, measurable, irrefutable data can go a long way toward putting forth that very first compelling why, why consumer, why the moments that matter that Laura highlighted, why the financial experience is probably the most immediate application I've really seen. I talked to an organization last Friday about this late in the day who had sort of said like, hey, we think we've got this licked. But when you actually began to peel the layers back and measure the ultimate outcomes, you know, the story was quite different. And it just led to a lot of really interesting conversation around, well, what are you doing? What are your strategic priorities in service of this? Do you have a priority in service of this? And if not, you know, how might this stack rank compared to what else you're contemplating?
Thank you. Well, Laura and Ryan, thank you both very much for sharing today. This is, as Sharon said, it is a very timely topic. I think consumerism has come a long way since we first thought about consumer and healthcare. So thank you both for joining us. And thank you everybody on the line for joining us today. I really appreciate the time that you all have taken. We are going to have a survey at the end of this. If you have a few minutes, would love for you to just to provide some feedback. Feedback is a gift, and we truly love both the feedback, both the positive and the constructive. So thank you all for your time today. If you could please take the last survey, that would be greatly appreciated.